Hello, I'm Dr. Dennis Alexander, a doctor of medical Qigong, licensed in China. The treatment you are about to see for Bell's palsy should not ever be done by somebody who is not trained in energetic techniques. You can cause a great deal of damage to an individual trying to do this without proper training. So, having said that, this then would be how you would treat Bell's palsy. We're going to be dealing with Bell's palsy, which is paralysis of one or sides of the face. And this is generally brought on when the trigeminal nerve system, which runs right before the ear here, is numbed. With Bell's palsy, generally one side of the face is paralyzed, and that is because of the trigeminal nerve here being numbed. This side generally is not paralyzed. The patient will drool, he will have tearing of the eye, and the first thing that you want to do with Bell's palsy is to purge that energy down and out the large intestine's channel, which comes off of the pointing finger. Okay? So you're purging that down, you're pulling that energy down and out, releasing some of this numbness and stagnation on this side of the head. Once you've done that, you use the extended palm technique and insert Qi into that affected area. And that's palm vibrating. You can do this with your hands on side by side. You can do it, I find it's more powerful this way, to break up the stagnation that's causing this paralysis. Then, using tiger claw kneading technique, you extend the fingers like a spike into the affected area and hit it to drive that energy from those 5 fingers into the affected area. And then you rake through that stagnation. Begin to purge that stagnation down both arms, off the face and both arms. What you're doing is equalizing the hemispheres. So you're using a vibrating palm with the open palm technique and bringing it down the arms and off of that large intestine's channel. Okay? Then apply compression and release. Compress and release. Compress and release. In front of the ear into that trigeminal nerve area. Compress and release. Compress and release. Begin to roll emitted Qi down one side of the face to the other. Paying attention to that nerve here. So what we're doing again is we're equalizing yin and yang. Hot energy, cold energy. Male energy, female energy. Both sides. So then dredge this towards the ear, and then roll this ear on a 45-degree angle this way. See what I'm doing? Okay? It's hard to do it on Arnold, he's plastic. But on my ear, I'm rolling it forward, 45 degrees. And what you're doing is you're rolling that energy into that trigeminal nerve. Then, from the eye and from the nose, tonify the tissues, emitting Qi into the affected area. Guide the Qi to circulate in small microcosmic orbit. That's the fire channel. And then this way. And then do microcosmic orbit here. And then finally, microcosmic orbit on the whole body. That's running the energy on the fire cycle. Fire cycle. Up the back, down the front, up the back, down the front. And then finally anchor all of the energy into the lower danchen. And that's your treatment for Bell's palsy. It's important that you do this as soon as you possibly can while the nerve situation is brand new. There is no time limit. You can do this on any Bell's palsy patient at any time. But you're going to get better results when you do it quickly from the onset of the disease. And that's it.